White House COVID coordinator Dr. Ashish Jha giving an update on the Biden administration's COVID contingency plan for the winter.
Let's bring in John Moore. He is a professor of microbiology and immunology at Weill Cornell Medical College. It's good to have you with us, Doctor. What's your take on what the Biden administration is doing? Is it normal to see cases going up like they are?
Well, we've seen it every winter during the pandemic so far, and I'm sure it will continue this one. There's no reason to believe otherwise. We started to see spikes in cases each year soon after Thanksgiving and into December, and the peak has been every year so far in mid-January. So we probably will see that again. I don't think there's any reason to believe otherwise.
One of the things we're hearing Dr. Jha say there is he's encouraging Americans to get their updated vaccine, trying to make sure folks are updated on their booster shots, and folks can head to covidtest.gov to get those free tests that the White House is now making available. But our Nancy Cordes pushed him on the fact that COVID deaths appear to be rising right now. He didn't seem to have an explanation for that other than the data. He seemed to assert that, well, hey, we're in a better position to respond to this because we're more knowledgeable. We don't need masks on planes anymore. But give us a bit of a reality check here. You know, we're not out of this pandemic. How serious of a season are we heading into as everyone tries to get together and enjoy the holidays?
Well, Dr. Shah is right that deaths are concentrated among older people and people in nursing facilities, people in vulnerable health conditions. They're certainly most at risk, and they are the ones who benefit most from protection, whether that protection comes from masking of people around them, or if they've not been vaccinated, then definitely they should get an updated booster, because that's the demography of the group that is dying. And currently we're at about 450 a day. It's gone up from around 350 or so a month ago. Yeah. So there is a trend upwards. And Dr. Shah is right. There are some reporting anomalies. I mean, there are data dumps that are done only every few weeks now that sort of have cause a blip effect. But, you know, that's a really technical issue. The fact is that older people are still dying and need all the protection they can get.
Yeah. We also heard the discussion about requirements, mask recommendations being different from requirements, and even that still has people with really strong opinions. Some people think that they're actually harmful at this point. Dr. Diane has told CBS News that we shouldn't all go out in masks because we need to actually be building our immunity back up to viruses. Where do you stand on this debate? How should we be approaching masks? Is this something that if you are in a vulnerable population you should be doing? Is it really something that's dependent on where you are? What's your thought? Because this is something that is increasingly confusing to folks.
Well, it is, and I don't see the government mandating anything. They've been reluctant to go into any socially controversial areas for months now, many months now. Yeah. They just don't want to do this. So that leaves it down to the individuals. And I think you have to assess your own personal risk and your own personal comfort zone. I've not been seeing a lot of mask wearing around New York City, whether indoors or, well, certainly not on the streets or on the subway. I think it's largely now been dropped by the population, rightly or wrongly. It will be very hard to change that behavioral pattern. I think if you are at risk of anything like a severe infection, if you're in a poor health category, if you're elderly, you definitely should wear a mask in an indoor setting. You have to protect yourself. And individuals are either going to do that or they're not going to do it. And I don't think there's any way now to really change the behavioral pattern we're now in.
All right. Dr. John Moore, thank you for helping us try and make more sense of this, and we appreciate all that you do.
Loving the Liverpool